And welcome back. Well, you've probably heard that stem cells are effective at curing pain. However, that treatment itself can be very costly.
Our next guest has a much more affordable healing option for people with chronic spine and body pain. Dr. Neal Pollack is a board-certified neurologist, and he is here to tell us all about prolotherapy. Great to see you this morning. So this is a form of regenerative therapy.
Say that 3 times.
Yeah, I couldn't even say it once.
Quickly.
Yeah.
Yes, it is.
So how does it work, and why is it that you think it's an effective treatment for chronic pain?
I know it's an effective treatment. It is one of the regenerative treatments, and they all work by producing a cellular response. The body wants to heal itself, and anytime you're injured, there's usually an inflammatory response, a cellular, regenerative, and then proliferative phase that strengthens and heals. The expensive stem cells, PRP, that a lot of stars and athletes have received, do this. But there's a treatment called prolotherapy that's used at the University of Wisconsin-Madison extensively. And it works just as well, and it's a fraction of the cost, and it's simplistic yet extremely efficient and safe. Now, how does it work? It works by producing this healing cascade. Let's say you have a shoulder problem, and I know you've had a shoulder problem.
We've talked about this.
Yes. There are many different parts of the shoulder. There's the intra-articular area, there's different ligament connections. The shoulder has 3 different bones in it. So you have to examine and find out what the problem is. And then when you inject in this area with a very safe solution, it produces a local inflammation that then starts the building process and proliferates and strengthens. And by doing these at like I said, a fraction of the cost, you're talking about $400 to $600 per treatment rather than $4,000 to $10,000 for these stem cells. The stem cells don't work any better.
Well, and I think that's what people will ask. A, is it as effective? You've said yes. Is it as natural?
It's more natural, and it's extremely safe. And like anything, it depends on the skill of the treater too.
Right.
And I've had a lot of experience with these techniques.
Speaking of the techniques and in talking with your patients, what are their experiences like with this treatment?
Their experiences are excellent. I've saved a lot of people from having surgery, and whether they've been completely fixed or become more functional, that's the rule.
Can you use it pre-therapy, like you said, to hopefully stay out of therapy? Can you use it after someone's had surgery to see if that will help heal even further?
You can, because after surgery, sometimes there are scar tissue responses and other types of accommodation of the body that are occurring and may be painful in and of themselves. So the answer is yes.
That's great.
Are there, in terms of patient experiences, what types of chronic pain are you treating most often, or has it been effective where maybe people have suffered for a very long time without relief?
I've treated conditions throughout the body, whether it's head, neck, shoulders, just go down the line, and it's been effective. You have to go in the right spots, you have to examine properly, and certain people need more treatments than others.
Well, I think anybody who's lived with a chronic pain, whether it's your knees or your back or your neck or your shoulders, whatever it is, you know that having some sort of relief can be life-changing.
It certainly can, because your whole being is changed when you're in chronic pain.
And everything responds to something else in your body. It's all connected.
You're right. If you're considering a regenerative treatment, this is your starting point.
Well, and I think it's worth noting that you find this to be just as effective, as you said, much more affordable, as you mentioned, safer, and as natural and easier to receive than stem cells.
Definitely. With stem cells, you have to get them from someplace. You're getting them from bone, or you're getting them from fat, or sometimes you're using an embryonic source that is foreign. Now, in my mind, I'm not sure how those are going to differentiate.
Right. Yeah, and your body needs to accept it as well to heal. So this is great. So people can contact you. You're at the Milwaukee Pain Clinic. When they do, they can come in, have a consultation, meet with you, and figure out exactly what's going on. So you can help them determine the regenerative therapy, like prolotherapy, that may be right for them. Call for a consultation and an appointment right now at 414-453-7780 for Dr. Neal Pollack, and ask for, again, prolotherapy. Thanks for being here, doctor.
Thank
Great
you.
to see you.
Yeah.
Thank you.
Absolutely.